Good evening. My name is Frederick Reedy from English 315, here to speak on a business proposal. Today's proposal focuses on continuous process improvement, more specifically on how can we improve occupational health reporting. Tonight we'll be going over the situation of the primary concern, the background or what we've discovered, our assessment of the situation, and the recommendations of how we may be able to improve this issue. The situation that we will be reviewing is that occupational illness and injury reporting has fallen to the wayside of our medical craft and needs to be rectified through understanding what an occupational illness or injury is, building better communication, change the culture of consultation and feedback, and inform our leaders of the continuous approach to bettering our practice of medicine. For the background to such discovery of the lack of occupational health, injury, and illness reporting, our lead occupational health provider found that per every 100 health encounters with our patients, only about 80 of the encounters, or 80%, should have been reported as being work-related as an injury or illness. This was found during a peer review while conducting quality assurance of each provider encounter. According to the Bureau of Labor and Statistics, an injury or illness is considered by the Occupational Safety and Health Administration, OSHA, to be work-related if an event or exposure in the work environment either caused or contributed to the resulting condition of significantly aggravated pre-existing condition. To help aid our understanding of various occupations that have hazards that can be potentially hazardous to our health and cause injuries, we have this bar graph. This graph shows various jobs such as flight engineers, structural and steel workers, and electrical power line installers or repairers. Each occupation can prove to be fatal with its hazards if not adequately identified or even cared for. To better understand how our healthcare providers take care of our patients, I spoke with Dr. Gagnon, a flight doctor who is well respected among the staff. He provided insightful knowledge of how the process of occupational health reporting requires such a drastic improvement. When inquiring on how he reports a potential occupational illness or injury, he simply stated, "As providers, our mission is to ensure a fit and ready force. We have the culture of treating the symptoms and not really looking into the larger picture of what may be an effect of what the patient is experiencing. We must get our people back to work to be ready to complete their mission." This shows that we're not really reporting any occupational illness or injuries currently. And this is a hazardous culture that we have identified, showing the needs to practice medicine with a mindset that's looking outside of the box. More over what the patient is stating, but also understanding what their daily lifestyle is or what their job may be. This culture of occupational illness and injury underreporting is not only an issue internally, but is also found across many other organizations. During a study conducted by Probst, Brubaker, and Barsotti back in 2018, they found that this has been a long-time issue that many hospitals are experiencing. This graph below by this study shows that there are drastic rates of the lack of reporting injuries. There may be reasons to why the reporting is not done. Many workers have a fear of retribution by their employers, coworkers, and even families for reporting their incidents. Some fear missing work and getting that valuable paycheck from being restricted. These restrictions are results of overexposures of hazards and even physical injuries. Also, within the medical field, many industrial illnesses may have symptoms that are similar to common illnesses. This creates a space for errors in our diagnoses. Lastly, as aforementioned, providers don't have a clear understanding of industrial exposures along with knowledge of effects of the chemical, biological, and physical hazards that some may have been exposed to. Although many hospitals encounter this clash of culture of proper treatment, we have to create that spark to make that ripple of change. So, how can we improve such a gray area in our medical care? We must first improve our knowledge of occupational health, injury, and illnesses. This can be done through developing monthly trainings and reference guides to assist each provider. We must also build our communication skills. Communication is the process of transferring information between senders and receivers, using either written, oral, visual, or even electronic media. To ensure a zero harm environment for our patients, we must embody this strong culture of communication and build that strong organizational foundation off of our communication skills. A primary tool that is used within the healthcare profession is Team Steps. Team Steps is a culture tool that is used to ensure that all services of the healthcare system provide a team approach to ensure all patients receive exceptional care. The crucial tool of communication models a superior communication as clear, concise, and timely consult. The sender and receiver must have no barriers of communication and must ensure the receiver got the intended message clearly. With no barriers being presented through the consultation, each clinic has the ability to perform a checkback. This checkback is when the sender of the message initiates the communication. The receiver accepts the message and provides feedback confirmation. And the loop is then closed when the sender of the message verifies the message was received properly. Embodying such a culture will open dialogue of consults between providers, enabling additional health information and strengthening our occupational health diagnoses. After we improve our knowledge and communication, we must be open to that feedback and understand that consulting with each specialty clinic is beneficial, and even our quality assurance is meant to be a beneficial tool to where we can find how to improve our diagnoses. So how can we embody such a continuous process improvement? We must have a SMART goal, a plan that is specific, measurable, achievable, realistic, and timely. To present this continuous approach, we must implement the skills that we have built and change the culture to see the change in our occupational health reporting. The goal is to see an increase in occupational health, injury, and illness reporting by 10% per every 100 patient encounters. This will be measured each quarter. This sustainable goal is measurable, attainable, and realistic, along with time observable, as we create the culture to have that crosstalk for consults, to be better at understanding and reporting all the illnesses and injuries that we may encounter. The occupational health clinic will be responsible for pulling this quarterly report. To ensure a timely report, this will be presented in each of the installation provider staff meetings to ensure awareness and further education if needed. This timely report is created through weekly rosters of illnesses and injuries from each clinic and will be compiled by the occupational health clinic. This will guide us to ensure our vision of exceptional healthcare that is provided to every patient with zero harm. So, in review, we've gone over the need for continuous improvement. We have the situation, which was the lack of illness and injury reporting for occupational health, the background, which is how providers lack the attention and knowledge of occupational health across the country, and the assessment, which is how our clinic and patients are affected by this discrepancy. Lastly, our recommendation is to build a strong culture for enhancing knowledge, strengthening our communication for consults, and accepting the feedback during quality assurance reviews. This cannot be fixed within one day and will require evaluation over time. We, as a healthcare, must provide that exceptional healthcare to every patient with zero harm and full understanding of the full concepts. Thank you.